In a bit. All right. Hi, everyone. My name is Dr. Faisal Nawaz. Most of you were there on the last session, but just to reintroduce myself, I am joining in from Dubai. I am a researcher and at the same time a resident doctor here in psychiatry. I've been working with Dr. Kashyap for a while, so it's great to see something great come out of it on the 5th batch of GRRSP. So welcome again. Today's session is going to take a very interesting turn. I'd like to think, as much as Dr. Rao did a good job, I think the first session, just because it's an introduction, the excitement and the fun side actually lies in this one and the next ones to come. So I hope this lives up to the expectations, and we'll be sharing lots of open discussions as well. So looking forward to that. I'll share my screen now. All right.
And Dr. Faisal, we are 6th batch, right? I just want to reconfirm.
6th batch, yes. Thank you. All right. So moving ahead, today's theme is research ideas. So the first session talked about, what is research really and how do you introduce yourselves to it? The end of the session had this homework in a sense where everyone takes some time to think about certain themes, certain topics that they may like, and then bring together maybe a research topic. And that's not something we completely expect you to have ready within the first session. So this will build on to your current ideas that you have in your mind. So before we go ahead, some updates from GRRSP. So firstly, this is exciting because 4 of our abstracts from the previous GRRSP batch were recently accepted at the Society of Critical Care and Medicine conference, which will happen in the US next year. So Dr. Rahul was leading a lot of them and mentoring the last batch. So it's great news for us to see where we're going ahead with it. The second update has to do with content of the lectures. So the PowerPoints, the presentations, YouTube recordings will be uploaded onto Google Classroom. So if you have a Gmail account or if you don't have one, please make one so that we can add you to Google Classroom and you can access all these contents and recordings throughout the program. The third update being social media activity. So one of the tasks for the last week was to make sure everyone creates at least a Twitter account or a LinkedIn account of themselves if they don't have one yet. And for those who did, amazing. It's already great to see your activities as a beginner and interacting with the GRRSP and other researchers out there. Keep that going. It's often something I see where the beginning is great and then slowly it slows down. So keep some consistency in your social media activity. And we've taken the group photo, so that's out of the way. All right, so objectives, we're going to talk about how we approach research ideas and how it is a little different when it comes to approaching ideas in general, in other fields, in healthcare in general. We're also going to go a bit about the do's and don'ts, some things that we should absolutely avoid when we're trying to go ahead with ideas or thinking, and look at some examples as well. So what are some published ideas? And when we hear the word published, what does it really mean? And what are the lessons we can learn from the publications around us? And then the second half of today's session, we'll have this open discussion where we expect you to share your ideas and then see how we can refine them together as a team. So it'll be a nice team building activity as well. So research ideas, I think we all have a brief overview of what an idea is in research and how we can make it something bigger by eventually having a topic which becomes published. So before we get that big fish, which is that publication, let's rewind back and see where do ideas come from? And there's many ways to actually gaining and gathering the right idea for you. It's sometimes different for other people. So maybe you're working in a healthcare setting or you worked in one recently. So clinical settings become a good source of idea generation. You see a problem there within your patients. Maybe you're seeing certain trends in the groups around them. So that's a good place to look into. The second one that comes to our mind is existing literature. And to me personally, that's one of the strongest sources, which makes you an independent researcher. So you don't have to tie yourself to a clinical setting to get the right ideas out there. So exploring the gaps in research, what are some papers that haven't talked enough about a certain topic that you're thinking about. So existing literature is a good place to look into. And we'll go a little deeper into how to explore the literature in the later slides. Society. So society means really anything and everything from the things you read online, and this could be through news articles, through major sort of announcements from the healthcare organizations. When the pandemic was declared, that was something that was a big announcement, and these are things you need to pick up from society in general. It also means through discussions, so scholarly discussions that happen around us. So this could be through GRRSP or through social media. You attend conferences, events. That's a place where you want to engage and gain some new ideas from scholars in the field. Some of the ideas might come from previous projects. So if you have worked on a project before, doesn't matter if it was published or not published, maybe it's just somewhere in the back. So maybe it's time to revisit some of the previous projects that could build onto as a new idea for you. So you don't have to always start from scratch. That's something that I keep in mind. And personal experiences. I think a lot of us, and especially with this batch, there's such diversity in the personal experiences we bring that you maybe not have to dive too deep into searching the literature and maybe looking into what are some topics, specialties, fields that relate to you on a personal level. Maybe it's a patient experience. Maybe it's a particular community that you've seen a certain topic that could become a research project. So keep your own identity and personal experiences in mind when framing the right ideas. Now, the process to research ideas, we often have this misconception in research where you have an idea, how can I translate that into a paper? But there's a lot of things that happen in between that. So you have the initial stage, which is the idea, and that's where certain themes emerge. It could be, a topic, a specialty. So you try to see what are some broad themes that come to my mind. And then it's about translating that into a way that other people in research can understand your language. So that is where the research question comes in, because you may have an excellent idea. Maybe it even wins a Nobel Prize. I hope so. But it doesn't matter if it can't be understood by others around. So we have to learn how to frame that idea into a research question. And eventually, when you have that research question, you refine it further. That's where you finally look at a research topic. So by the time you get to your research topic, it's a bit of patience and it's a bit of feedback from others around you. So I think there are 4 major steps that when we look at the process of idea generation, you start from brainstorming the research ideas, as we talked about, from different sources around you. And in particular, some literature sources which you may have heard of, like PubMed, is a great place to start from. And another thing that some may not be aware of is actually a hidden, it's not even hidden, but it's actually not known enough, is Google Scholar. So try looking into what Google Scholar is, because it goes outside PubMed as well. So you want to cover as much of breadth when you're searching papers. So these two, and there are many other examples, but if we're just looking at the 2 best ones that help, I would say PubMed and Google Scholar. Step 2, after you have now identified, okay, I think I know, maybe I'd like to do some research in, COVID-19 or maybe critical care. I saw a few themes and some papers that are connecting my ideas together. Now put it into a framework. So that's where Dr. Kashyap in the first session touched on the PICO framework. And we will expand on this in the later sessions as well. But it's a good idea to start thinking early and seeing what is the population that this idea could benefit from? What is the intervention or the exposure that we apply? Am I comparing this with something else? Maybe it's a medication, maybe it's a disease. And what is the real outcome that I want out of this research topic? So you'll try to at least, and you may not actually have answers to all of them at the beginning, but at least this will help you narrow down your idea to something more specific. And then when you have a strong framework by now, step 3, which comes down to that research question. And then you refine that question using certain techniques, which we'll discuss in this session, along with feedback from your peers, from your seniors and mentors around. So step one, idea generation, as we talked about PubMed and Google Scholar. These are free online databases. And I think what's even worth highlighting here is how do you often search on a PubMed or a Google Scholar database? So I don't think you should complicate it much and really keep it to key terms that you think connect your ideas together. So just as an example, if I am interested in mental health of students during COVID-19, well, mental health and students and COVID-19. Keep it simple, keep it straightforward. Same applies to Google Scholar as well. So you use both of these and see if you gain at least maybe 3 to 4 example papers, not too far into 1980s. You want to look any recent papers and publications that are out there about it. Then you have the PICO framework. So we've already touched on that, patient population. So let's actually look at an example here. So maybe you thought about a certain population. So children, maybe pediatrics would be something you're interested in. Intervention. So maybe there was a medication that was used or a particular thing that they're exposed to. Maybe video games, maybe mobile phone usage. So that could be an example of an intervention. Control or comparison, if it applies to your topic. You don't have to have a control or comparison all the time, but maybe you're comparing it to a different medication. And then you have an outcome, which in this particular example was temperature. So what this PICO helped you was to actually create the next step, which is the question. And you can see how is acetaminophen or ibuprofen more effective at reducing fever in children, is what you brought out. And this is something I can understand. I can be on the complete other side of the world and I can understand your language of research now. So that's the real benefit of using this PICO framework. Now that you've maybe looked at the idea of, okay, I've had an idea now, I have searched the literature, I don't think, I'm very confused at this point and I have somewhat of a research question built up, you're still not there. So the research question, when the first version of your question is out, it's often a very rough and perhaps very broad in terms of research ideas. So you want to refine it a bit. And that's how one way to do it is actually to consider the finer criteria. So finer, F is feasibility. So this is where you ask yourself, what are the people involved in this research question that I'm looking at? Is it too broad? Maybe I could narrow this down into a certain age group or country or community. So this helps you narrow down your feasibility of people. Expertise. So, if this study that I really like now, if I move ahead with it, do I have people around me who could help me as a team in building this further? Sometimes there is extensive technical expertise that's needed, especially with, for example, artificial intelligence-based studies. So you might be interested in that, but if you don't have the expertise around, the feasibility doesn't work. You have time. So we touched on this in the last session. So how long can this study take? And that partially depends on what type of study you're looking at. And I'd like you to get familiar with the types of studies. So we'll be mentioning a few names like randomized control trials, cross-sectional studies. So you need to get used to those. And some of them might take far longer than how much you can give in. So that is a good thing to keep in mind. And then funding, potentially some studies might, in fact, most studies might reach a point where you have to think about how can I fund this paper? It could be as a publication to a journal. Sometimes you need funding for resources if it's in a hospital setting. So think about that early on instead of, keeping it at the end. Then you have I, which is interesting. And to me, in fact, this is one of the very important defining factors of whether at the end of the day, this paper gets accepted. So is it interesting? And how is it interesting? It's interesting in the sense, does it apply to public? Does it apply to patients around you? Will it actually help build on to existing research studies? So you want to be a part of the research timeline, not create something that is not going to be of interest to research. And healthcare, does it improve or at least give us some answers to either the burden of the disease or the population group you're looking at, or maybe the cost of a certain impact that it has? So some diseases cost a lot to healthcare systems. So is it helping healthcare in some way? And N would be how novel is it? So how new is this idea? And then that's another defining factor to whether that journal is going to like your project in the end. So has it been done before? And that's where your homework, which is that literature search, really plays a role. Sometimes I have seen, students who might have great ideas on their own and they think through the whole question, but if their literature search was not invested enough, they didn't spend enough time looking at existing papers, they realize it too late. And by then they realize there's an exact study already done, same population, same groups. And chances are your study now won't be published because you don't have the novelty that it brings. E would be the ethical aspect of your study. So ethics is a big word, but just to give you a few pointers, I think considering, is my study, complying to the ethical guidelines of wherever I'm doing research in? Is it being inclusive? Is it keeping in mind of systems, cultures, genders, things like these when we try to frame our research question? The last point are being relevant. So, it ties in with the interest, which is it relevant to advancing science? So we've looked at ideas, we've looked at how to maybe think through your first research question and how you can refine it further from a very rough format. Now I'd like us to go through a few successful examples here. And by successful, I mean these are publications that have come up in the last couple of years, some by myself, some by Dr. Kashyap, some outside the box ones as well. So the first one here is on the top left corner. So you have a study on the critical care practices in the world, the results of the Global Intensive Care Unit Need Assessment Survey. That's a mouthful of a topic, but let's try to break it down. And what this survey looked at was a cross-sectional survey where at a given time, we looked at critical care practices. So ICUs in the world, and the word needs assessment. This translates to what is the current need of a certain healthcare setting. So I hope this is giving you maybe some ideas on maybe there's a certain survey you could build, which is going to apply to a needs assessment of a certain healthcare setting. And you can see how the topic was catchy in the sense where we're looking at a global survey here. Maybe in your case, you'd be interested in a particular country or a hospital alone. So a lot can be brought out from a title itself. And the second example is down there, which is readiness to embrace artificial intelligence among medical doctors and students. So this is another questionnaire and survey-based study where we looked at what is the current. So you can look at many things from a survey, and three things that really catch my eye and is worth noting down is knowledge, perception, and willingness. So these are often very interesting to journals to see. So in this study, we looked at what is the current knowledge of AI among medical doctors and students. And maybe you're interested in the knowledge of something else in your research specialty. Perception, so how do people perceive that? Maybe there are certain topics that might be better explored about in terms of perspectives and perceptions. Stigma-based topics, if there's a certain stigma in the community, it could be violence against healthcare workers, it could be mental health stigma. So that's worth making a survey out of. And willingness is an interest of certain people. So how willing are people to maybe talk about something, or how willing are they to accept a certain technology like AI, for example? So these are some ideas when it comes to survey-based studies. Another example, which is a different kind of a study and more on the clinical research side, which would be, we can go over it. So low birth weight prevalence in children diagnosed with neurodevelopmental disorders in, for example, in this case, Dubai. So you can see how there's the keyword low birth weight, which is the main variable that was looked at. Prevalence. So prevalence is a strong word here. And that's where you're looking at what is the sort of current number of certain diseases or people with a certain characteristic. And a population was defined. So children, maybe it could be adults in your case. And then there's a diagnosis of neurodevelopmental disorders. Maybe it's kidney injury for you or some other diagnosis. And then we narrowed it down further by looking at the location. So in this case, it was Dubai. Maybe it could be a country, maybe it could be global. So a study like this is usually when you would look at maybe hospital records, you would collect some data through the hospital records, you'd need an IRB approval, which is an institutional ethics board approval before conducting a study like this. So it's good to keep that in mind if that's something you're interested in. And more importantly, a study of this kind, you collect data retrospectively. So that's another word I'm introducing here. Retrospectively, you're going back into patient records and you're trying to build onto data rather than looking into prospective studies, which is into the future. The third kind of paper or research idea is commentaries, basically. And this is often underutilized within researchers because these are the small fruits of research. In terms of the research pyramid, which is something we talked about in the first lecture, this would be lower down that pyramid in terms of the impact you create. But it is a good way to put your name out there, to connect yourself to a certain topic you're interested in. And often it has a very scientific, opinionated way of writing. So this does not involve data that you collect, but commentaries are you're commenting on a very hot topic in healthcare or research out there. So one example is a publication in the Annals of Medicine and Surgery on the topic of rise of monkeypox. So this is when monkeypox just came out, and you keep a lookout on something new. So rise of monkeypox, what are some lessons from COVID-19 to mitigate this global health crisis? So then you write maybe 1,000 words, you convey a very specific point, which could be a lesson, and that could maybe get accepted within a couple of weeks into a paper publication. And you'll see even in the coming weeks where Dr. Kashyap and myself might be sharing some exciting commentary invitations. So some journals accept only based on invitations. Some you can freely actually submit and see if they accept your paper. So we'll keep this in mind. And the second one is a paper, again, another commentary in the Lancet, which is on a particular health topic in a country like Afghanistan, where respiratory health and critical care concerns were spotted, but not talked about enough. So you look at a commentary paper that is about a topic that people are not talking about enough. Maybe it's a call for action for more research to happen. So that's the theme of commentary papers. The third one, which I am almost confident no one has probably thought about. This is also one reason why having a social media account plays a role. So social media research. This is where you look at so much data that exists within social media platforms. So Twitter, LinkedIn, Facebook, these are all factories of data waiting for you to get analyzed and to make a difference by understanding people's perceptions, people's interest in certain things. And hashtag analysis is something that's really growing interest now. So just as an example, on the left side, there was a hashtag which I created, and maybe it's something you create as a hashtag, or maybe it is a hashtag that you see on Twitter anyways that exists. And that hashtag in this case was about the topic of medicine and AI. And hashtags are often a way where communities come together and talk about certain topics. So there's a hashtag like MedTwitter, so that's medical people on Twitter. And using certain programs, you can analyze the impact that this hashtag makes. So then you can write a paper about maybe your specialty of interest and the hashtag that is popular in that specialty. So that's what we call hashtag analysis papers. And the exciting news about this is this counts as an original study. This is not a commentary. This is not in any way. You have data, you have analysis, you write up the whole paper. This particular one was in the frontiers of public health. The one on the right was another hashtag called DHPSP, which was again created more about digital health and patient safety-based awareness. And I see other hashtags as well. So if you're interested in maybe critical care, so there's hashtags on that. We're trying to build a hashtag at the moment, which is called hashtag mentoring in healthcare. And this hashtag, when it gains enough momentum, we can then analyze on a global scale, how do people talk about mentorship in healthcare? So keep that in mind if there's a certain topic that you think might turn into a nice social media research paper. This is an example of systematic review papers, which is, to me, one of the very high impact level papers you can bring out from especially this program. So here we have two papers, and both are papers that were co-authored by Dr. Kashyap. And first one is looking at the outcome of adverse events and medical errors in the ICU. So this really looked at a review. So this is a review-based paper of maybe the big themes of adverse events that happened in ICUs. And this is where you compile a paper, you go through a systematic review process, and hopefully that is something that turns into a major publication. The second one is more of looking at a particular medication. So like remdesivir, what is the mortality benefit of remdesivir in COVID-19? So sometimes certain topics are published very heavily. It doesn't, there's not a problem of gap in publication, but there's a gap of a systematic review that can bring it together and help other researchers to understand. So if I want to read about what is the benefit of remdesivir, I have to search through hundreds of papers alone. But if I have a systematic review like this, I'm going to read a very comprehensive review and maybe even cite that paper into the work that I'm doing on remdesivir. So systematic reviews gain a lot of citations. So if you're particularly interested in the academia route and just in general, I think systematic reviews give you a really nice edge there. Now we're going outside the box. So this is where you want to look at maybe a topic like the Nobel Prize. So this is a very recent publication where people looked at the mortality and immortality of Nobel Prize winners. And to give you a quick result of the study, basically they found out through research that people who won Nobel Prizes had a lifespan of an extra 2 years added if you win a Nobel Prize. Just something to think about. And if that's not exciting enough for you to go for that Nobel Prize, I don't know what is. You get to live longer if you win one. So this is an example. And on the same topic of Nobel Prizes, I think it's also worth noting that this is an example of someone who's recently won a Nobel Prize. And this was a Nobel Prize with someone with an H index, which is a metric. So an H index is a measure of your research impact as a researcher. So 29 is not at all close to what we'd consider someone with a very high impact in research. And yet someone like Dr. John managed to win a Nobel Prize. And what that shows is the quality rather than the quantity of your research work and the impact you create. And all of us have that potential to actually win a Nobel Prize if you focus on the quality of research. So what are some don'ts and absolute things to avoid when you're building that research idea and topic? So try not to keep it too broad. A very broad topic is going to create more problems in the future. You have too much of data then to look over. Maybe it's not going to be easy to write it up. Journals may be not interested in it because it's too confusing now, because there's maybe, so an example would be, I'd like to have a research topic on the effect of painkillers on people with heart disease. All right, so just a random idea here. Now, when you say something like this, it is really broad because you're looking at heart disease here. You've got enough heart diseases to write a book on it. So you want to narrow that down and not keep it too broad by maybe specifying a certain heart disease, so, or in a certain population. So that's a big don't. The second one is repeated topics. So we don't want to recreate the same thing in research that's already being done. The third one is irrelevance to current science. So some topics might be very interesting, but are they really making a difference to healthcare? Are they advancing science? So keep that in mind as you build your research idea. And last but not the least, you have the saying in medicine, which is do no harm, but that applies just as much to research. And that do no harm is in the form of the research topic, the people you deal with, the people you work with, and even to yourself. So don't harm yourself by picking a research topic that is going to maybe bite you after a few years, and people will question your place in research because of that topic. So don't go after something that is extremely controversial and that affects your portfolio of research in general. So that was a little bit of a summary on research ideas, and I hope it already started some stimulating thoughts in your mind, and we'll talk more about your current ideas as well. I wanted to go over quickly some upcoming opportunities that at GRRSP you'd be able to have some exposure to. So one thing is a book authorship, chapter authorship opportunity that might come up through one of our collaborators and guest faculty, Dr. Salim Surani. So that is something to look out for. Another one is a recent book chapter authorship opportunity on the topic of antidotes to toxins in drugs. So just putting that out there as something which is by Elsevier as the publisher, and a chance to add your name to that. And then there's a call for papers through Dr. Kashyap's role in Frontiers journals. So if you're interested in the topic of eating disorders or mental health stigma, that is another opportunity that awaits you. So that's besides your core projects, your core ideas. So our ideas will keep bringing these opportunities to you more and more, but you have your main work to do, which is going to be your main project. Dr. Kashyap, you want to add anything to this slide?
No, this is good.
Perfect. And yeah, I think looking at just the research idea alone is not enough. So you want to make sure that through this program, you're building the soft skills that are required. And that means working with people. So great leaders are not the best at everything. I'm not the best at anything, I'd say. What I like is people who can find people who are best at different things and get them all together. And that's what GRRSP is going to give you in the coming weeks, because you're going to be working on ideas together. You're going to build on a project together as a team. And that to me is a very exciting thing about research. So you're all going to be Avengers of some sorts over the coming months. So that is all I have from my side. And the second half of the session will be about actually hearing your ideas that you've thought about over the coming week. And that's where I'll hand it over to Dr. Kashyap, and any questions, of course, are most welcome.
Thank you so much, Faisal. I'm going to stop the recording and we'll go into our research idea discussions for now.